Hi, my name is Elizabeth Appling, and I'm a nurse practitioner here at LUX A Medical Spa. And today I have my lovely assistant, medical assistant Erin here, who is going to allow me to kind of demonstrate the dosing and why we map the way we do, why we dose the way we do with Botox or any neuromodulator. So today, Erin has decided that she wants to treat her frontalis, which is her forehead. She wants to treat her glabellar complex, which is this group of muscles here. And then we want a little bit of a brow raise. So that is going to be treating what's called the orbicularis oculi. So this muscle is a very strong muscle. So often our dosing here ranges anywhere from 2 units per injection site up to 5 to 8, depending on the muscles. Erin is quite young and doesn't need a whole lot of Botox. Can you make your frowny face? And so you can see she doesn't have a lot of muscle movement here, so we're not gonna need a high dose. Dose equals freeze, but dose also equals duration. So if we're looking at getting her at least a 90-day duration of her treatment, we're going to want to dose her to get a 90-day duration. When we're looking at the forehead muscle, we have to always take into consideration where is her brow placement now. She has a really healthy brow placement, again, because she's young. If you are 40s or later, you might have a little bit of a lowered brow. So we wouldn't want to then lower that dose, lower your forehead even more with a heavy dose. So when people often say that they feel heavy, most of the time we need to look at placement, but sometimes we need to look at our dose. For our lateral brow, we also need to know we don't need to go too far in, but we want to get a brow lift here. So we want to dose to bring the brow out rather than up. So we want to dose here. So these would be 2, 3, 4, that sort of dosing. Each marker spot does not equate to 1 unit. So we can choose 2 units, 4 units, but again, this is going to match the patient, her muscle movement, and her previous experience with Botox if she has had that. I've treated Erin before, so I know that oftentimes she doesn't need a 5-point injection here. She only needs 3. So we customize each patient's treatment to match their needs while also taking into consideration the safety and recommendations from the American Society of Plastics.